Hello everyone, my name is Dr. Izioma and I'm founder of Tenderly. I want to appreciate every member of this community who has joined and who's been patient with us, enjoying our daily tips. Shout out to every one of you. For those who watched the video I made on my time at the delivery room, from delivery to handover, newborn's first moments, I want to appreciate every one of you. And I did it with a lot of excitement, and about 2 days afterwards I went to work and I found out that about 70% of babies admitted into my unit were admitted because they didn't cry well at birth. Basically they had varying degrees of birth asphyxia. It's been so distressing for me and for the other pediatricians managing these babies. I mean, why would you want to put a baby through this kind of stress? You can even try it on your own. How long can you stay with them just holding your breath? And then a baby comes into the world and is unable to cry, is unable to breathe. It's painful, you know, and it's worse when you actually walk into the situation and then they are actually preventable causes. You have your delivery at a traditional birth attendant's place or where there is no skilled birth attendant. It's not fair. I know sometimes for some other people they actually did everything they had to do, attended the antenatal care, took their medications, but along the line one or two things went wrong and then they're faced with that kind of situation. Yeah, I just think it's sad, it's painful, but I think it's a bit easier maybe to live with. Looking at the baby at the time when you're supposed to be resting, you're in the hospital, you're struggling, we are trying to help the baby's lungs and get mature, breathe. And then the brain is already damaged. The brain is supposed to be the powerhouse of the body. And so many things just go wrong. Other organs are affected and some of them are convulsing away. Some of them have kidney problems. There are just so many issues. What about the long-term effects? Their IQ is affected. Some have hearing problems. Some become blind. There are just so many things. It's quite pathetic, and I really would want to educate us on birth asphyxia. So next week I had planned to do something else, but I'll shelve it. Let's trash out birth asphyxia. You can imagine what we are faced with, the parents are faced with. It's not fair. So next week we're going to be talking about birth asphyxia. I really would want to do that to help educate us. Then I also want to use this opportunity to shout out to a member of this community. I remember the first time our paths crossed. She was supposed to have her baby in the hospital, and because she had had a bad experience with her first baby, she insisted that a pediatrician must be there for her baby's delivery. And I was called upon, and honestly it made a world of difference. I really appreciate her and her husband for that decision. When I look at that baby now, maybe it's about 2 years plus. She's a joy to behold. She had another baby and she did exactly the same thing. In fact, she started telling me from when she was about 4 months pregnant. And she told the doctor, if you're not going to allow a pediatrician, in fact, at this point was my pediatrician coming, I won't have my baby in the hospital. And to be honest, it also made a huge difference. I hope I can get her to share her experience here one of these days. Do have a wonderful day. And please pray for me as I get back to work. Pediatrics is my passion and my pride.
Tenderly, touching lives with tender care.